Good morning. Maternal and infant health. Hi everyone. I'm Emmeline Lao, a labor and delivery nurse at St. Mary Medical Center. In this presentation, I'm going to talk about maternal and infant health, which is the topic that my health communication portfolio aims to promote. I will first talk about the timeliness and relevance of my health topic and the need to spread awareness about it. Thereafter, I will present my multimedia materials which are geared towards the promotion of maternal and health infant among my target population. Why I chose this topic? Improving the well-being of mothers, infants, and children is an important public health goal for the United States. Their well-being determines the health of the next generation and can help predict future public health challenges for American families, communities, and the healthcare system. Despite major advances in medical care, critical threats to maternal and infant health exist to this day. Globally, millions of pregnant women, new mothers, and infants experience severe illness or death largely from preventable or treatable causes. In the US, of the more than 80% of women who will become pregnant and give birth, 31% will suffer pregnancy complications. The US also statistically fares worse in preventing pregnancy related deaths than most other developed nations. On the other hand, over 23,000 infants reportedly died in the United States in 2016. The identified leading cause of infant death were birth defects, preterm birth and low birth weight, sudden infant death syndrome, and maternal pregnancy complications. The risk of maternal and infant mortality and morbidity can be reduced by increasing access to quality preconception, prenatal, and interconception care. Healthcare before, during, and after pregnancy provides an opportunity to identify existing health risks and to prevent future health problems for women and their children. These problems include heart disease, diabetes, genetic conditions, sexually transmitted disease, and unhealthy weight. My health communication plan is designed to promote maternal and infant health among the female residents of the city of Carson in California. My goal is to improve maternal attitudes and behavior before, during, and after pregnancy to prevent illness and diseases among mothers and babies in Carson. To provide a demographic overview, the city of Carson had a population of 91,714 according to 2010 US Census. For every 100 females aged 18 and over among the population, there were 88.5 males reported to live in Carson. Currently, there are several healthcare facilities in the city of Carson that provide cost-effective maternal and infant health care services to its residents. Improved maternal and infant health can be achieved by effecting positive changes in the attitudes and behavior of women and mothers in accessing the availing of preconception, prenatal, and interconception health care. My health communication plan will adapt the health belief model to achieve the desired attitudinal and behavioral changes toward maternal and infant health care. To the health belief model, women in Carson who plan to have babies and those who are already pregnant will be prompted to contemplate the perceived threats of diseases from lack of proper maternal and infant health care and the perceived benefits of taking preventive measures and early treatment to address maternal and infant mortality and morbidity. The health belief model will provide a solid theoretical foundation for my health campaign to encourage the women to take positive and concrete action to improve their health and well being, and also that of their babies. There are numerous materials and methods available to use for an effective health communication portfolio. One way of promoting maternal and infant health is by writing an article or blog post providing vital and useful information as to the prevention and treatment of an illness or disease. One such disease is chlamydia infection among pregnant women. Chlamydia is one of the most prevalently sexually transmitted disease and has comprised the largest proportion of all STDs reported to CDC since 1994. Pregnant women infected with chlamydia can pass the infection to their infants during delivery, leading to health complications in the babies. Given that chlamydia infections pose serious threat health risk, not just to women, but also to their babies, pregnant women need to be well informed about this disease. The blog post I wrote provides 10 fast facts about chlamydia and recommendations on how pregnant women can protect themselves and their unborn babies from getting infected. Another material that can be used in health promotion is a poster to provide valuable information at a glance in a visually appealing format. As part of my communication plan, I made a poster to convey important messages on breastfeeding and other health topics that supports maternal and infant health. Breastfeeding has been proven to provide unmatched health benefits for babies and mothers. It is considered as the clinical gold standard for infant feeding and nutrition, with breast milk uniquely tailored to meet the health needs of a growing baby. However, while breastfeeding is a natural act, it is also a learned behavior. Mothers and other caregivers require active support for establishing and sustaining appropriate breastfeeding practices. Towards this end, the poster I developed promotes breastfeeding and its benefits through the use of succinct yet impactful messages. The poster highlights that breast milk is best for providing valuable nutrition and protection to babies. To support my messaging on the importance of breastfeeding, I included in my portfolio an infographic from the World Health Organization, which provides a more detailed and comprehensive discussion of the best benefits to breastfeeding. In addition, it also presents recommended actions and essential interventions to protect, promote, and support breastfeeding of mothers. To cap off my communication portfolio on the promotion of material and infant health, I adopted a second education piece from WHO, which is presented in a video format and can be viewed on YouTube. This 3-minute video is geared towards those who are visually oriented and is educational and compelling in raising interest on maternal and infant health. It emphasizes the importance of access to essential, timely, and quality maternal and infant health care to avoid preventable diseases and deaths of mothers and babies throughout the world. Maternal and infant health is undoubtedly an important public health issue. Mothers and babies are entitled to special care and assistance as they are susceptible to various health risks and vulnerabilities. Access to essential and adequate maternal and infant health care is critical to decrease maternal and infant mortality and morbidity. Consistent and concrete efforts at the individual and organizational levels must be taken to positively change attitudes and behaviors towards maternal and infant health. This will ensure quality healthcare access and provision, as well as effective health literacy and education, which will provide mothers and babies with the highest standard of health. When mothers and babies are healthy and strong, the overall health and well being of the general population is guaranteed. This ends my presentation. Thank you and have a great day.